Hi guys, so this chapter is going to be chapter 27, and this is about the hematopoietic, the lymphatic system, on its function, its assessment, and the therapeutic measures. And so this is a really short chapter, and because of that, a lot of people think, oh, it's not that important. But you need to remember that the hematologic system affects every body system, and caring for a patient with a hematologic disorder can be especially challenging. So what I mean by that is a patient's dyspnea may lead you to suspect that there's a respiratory or even a cardiovascular condition when the primary problem is actually anemia. So to ensure accurate diagnosis and effective care, you need to obtain an especially thorough history and physical assessment when a patient is suspected of having a hematologic condition. So it's also important to remember that, we want to help our patients survive these disorders because a lot of times we're dealing with, immunomodulator issues or even sometimes cancer disorders. So even when the prognosis is poor, you can help your patients make the necessary adjustments to maintain an optimal quality of life. So we'll flip through those learning outcomes and let's talk about the A and P. Okay, so the hematologic system consists of blood, the major body fluid tissue, and the bone marrow, which manufactures your new blood cells in a process called hematopoiesis. Blood delivers oxygen and nutrients to all the tissues, it removes waste, and it performs many other different tasks. So the blood is going to consist of various formed elements or blood cells suspended in a fluid called plasma. So plasma is the liquid form, okay? The formed elements of the blood include our red blood cells or our RBCs, or you'll hear them called erythrocytes. It also consists of your white blood cells, WBCs, or your leukocytes, and then platelets, which are sometimes called thrombocytes. So red blood cells and platelets function entirely within the blood vessels, whereas the WBCs act mainly in the tissues outside of the blood vessels. So let's talk about each one of these because I think it's important to kind of look over this stuff. So red blood cells, okay? So if you can figure out what each one of these components does, it's going to help you when we get to the next chapter, understanding like your anemic disorders versus like your thrombocytic disorders versus your leukocyte disorders. So let's talk about the red blood cells. Red blood cells, they transport oxygen and carbon dioxide to and from the body tissues. Okay, we've talked about this in other components. They contain hemoglobin, which is that oxygen-carrying substance that gives blood its red color. The red blood cell surface carries antigens, which are substances that trigger formation of antibodies that interact specifically with that antigen. And these antigens determine a person's blood group or its blood type. And I'll talk about blood types in a little bit. So constant circulation wears out the red blood cells, which have an average lifespan of 120 days. The spleen sequesters or isolates the old worn out red blood cells and removes them from circulation. So if you didn't know what the spleen does, that's what it does. This process requires the body to manufacture billions of new cells daily to maintain red blood cells at normal levels. The bone marrow releases red blood cells into circulation in an immature form called reticulocytes, which mature into red blood cells in about a day. The rate of reticulocyte release usually equals the rate of old blood cell removal. And when red blood cell depletion occurs, for example, with a hemorrhage, the bone marrow will increase reticulocyte production to maintain normal red blood cell levels. So there it is. That is how red blood cells are made, how they circulate, and how they're removed from the process. So blood falls in one of four groups, and I'll talk about blood a little bit more specifically in a little bit. In type A blood, the A antigen appears on the red blood cells. In type B blood, the B antigen appears. Type AB, it's going to have both A and B antigens. And type O blood has neither the A antigen nor the B antigen. And blood from any of these types also contain the rhesus factor or the Rh factor antigen. Blood with the Rh antigen is either going to be Rh positive, or blood without it is going to be what we call Rh negative. And that's where we get that O positive and that O negative. It has to do with that Rh factor. All right, let's talk about plasma. Plasma contains antibodies or immunoglobulins that interact with these antigens, causing the cells to clump together. However, plasma can't contain antibodies to its own cell antigen or it would destroy itself. So to explain that a little better, type A blood has A antigen, but no anti-A antibodies, although it does have anti-B antibodies. Okay, and again, we'll explain this a little more when we get to red blood cells or blood transfusions. The principle is important for those blood transfusions, and the donor's blood type must be compatible with the recipient's. Otherwise, a transfusion may be fatal. That's why precise blood typing and cross-matching, which is mixing and observing of the agglutination or the clumping of donor cells, is going to be very essential. All right, let's talk about white blood cells. Okay, white blood cells, this is kind of a lengthy one. I probably should have done platelets first, but let's do white blood cells. The 5 types of white blood cells: you have neutrophils, you have eosinophils, you have basophils, monocytes, and lymphocytes. They participate in the body's defense and immune systems. And white blood cells are classified as agranulocytes or granulocytes. And it's all based on the shape of the nucleus, the presence or absence of granules, and the affinity for laboratory stains and dyes. Okay. I'm not going to go through each different type because this is not a specific A and P class, but do understand that the white blood cells are responsible for that defense of your immune systems. Okay. Platelets, on the other hand, are small, they're colorless, they're disc-shaped, and they're fragments split from very large bone marrow cells. Their lifespan's approximately about 10 days. The platelets have 3 vital functions. They initiate contraction of damaged blood vessels to minimize blood loss. They form hemostatic plugs in injured blood vessels to help stop bleeding. And along with plasma, they provide materials that accelerate blood clot formation and coagulation. So that is what each one of these components does. So you do have to know kind of the main point of each one so that you understand how these disorders are going to work. So here's from your book. This is the components of blood. So when you draw blood, this is what it spins down into, okay? So when we draw the blood, of course, it's that dark red color that we get. And then the lab actually goes in and splits it even further. And so you can see the top part is the plasma. That's that liquid part of the blood. And then the red blood cells, white blood cells, platelets all will settle down into the bottom. So you can see that from that test tube there. Again, this is another picture from your book about blood cell formation. So as I was talking about, you know, most of your cells are going to lie within that red bone marrow. And you can kind of see how the cells are actually formed. So down there at the bottom left, you can see your red blood cells or your erythrocytes. In the middle, you can see, as I was kind of alluding to, your white blood cells, which are your granulocytes versus your agranulocytes. Your granulocytes are going to be those basophils, the eosinophils, the neutrophils, and your agranulocytes are going to be your lymphocytes and your monocytes, okay? And that'll be a little bit more important when we talk about like your white blood cell disorders, for example, like leukemia, or if you're talking about like lymphoma, that would be particularly your lymphocytes instead. And then on the far right, you've got your platelets or your thrombocytes. So these are the 3 different types of blood cells that you get from within the bone marrow of your patients. And then again, here's another picture, the breakdown of your red blood cells, and you can kind of see what roles the liver and the spleen have in terms of red blood cells. One of the things that you do see that's very, very common when you have the liver and the spleen, they ingest and they destroy those old red blood cells. I want you to look down at the bottom and look, you know, specifically, one of the byproducts of red blood cell destruction is going to be iron and bilirubin, okay? So when you have a patient that has excessive red blood cell destruction, for example, you're going to have excess bilirubin, which means that your patients a lot of times are going to be jaundiced. So if you have a jaundiced patient with an immune disorder or a hematologic disorder, our first instinct is to think, oh, it's the liver, but it could be just that destruction of red blood cells, which is giving them that jaundiced color. And then again, here's another picture from your book, the formation of a blood clot. So you can kind of see how the prothrombin activator happens to give us those clotting factors that we need. Here is a picture also from your book. There's lots of pictures in this chapter of the lymphatic system. So as I said, the lymphatic system, while a lot of people just don't really think about it that much, it is responsible, and we consider it hematologic and circulatory because it has that circulatory component. It has every part of the body that's going to be affected. So again, if you have a lymphatic disorder, or we have something that gets into the lymphatic system, it's going to go everywhere. As you can see, we have lymph nodes all throughout our bodies. All right, let's talk about the aging changes. Okay, so aging changes of the hematologic and lymphatic system. So as we age, you have less efficient immune response, okay, which we kind of know that. The very old, the very young, very susceptible to infections because of that less efficient immune response, okay? Another component of aging is iron deficiency, okay? Iron deficiency, also coined with slowed erythrocyte production or slowed red blood cell production, puts our aging individual at risk for anemia. So anemia is very, very common in our elderly patients as well. And as we get older, we also have a reduced plasma volume. Remember, plasma is the liquid part of the blood. So if you have a reduced plasma volume, that puts your patient at increased risk for dehydration. Okay, so the big things in terms of the hematologic lymphatic system for the elderly: increased risk for infection, increased risk for anemia, increased risk for dehydration. All huge things that we have to monitor our patients for. All right, I'm going to go ahead and do a separate recording for the history so that we can kind of split this up a little bit more.